Okay. Okay. So here is, wow. Okay, so here is your first online lecture from me. I'll take advantage of the fact that these are not synchronous to do different lengths, and this one will be relatively short. I'd like to talk about um, e economic policy responses to the coronavirus, and I very much like how Donald Barone is laying it out here. So let's take a look at that. Um, so so he talks about a three-part macroeconomic strategy, but when you get down to it, there's really a third, which is trying to help out folks who are of low and moderate income who are hurt financially by this crisis quite seriously. So I'll talk about that too. So he says there's three parts. The first part of our economic response is that we actually want GDP to go down in this first part in order to fight the virus. So let me lay that out in a little bit more detail here. Let's go to a very small PowerPoint file. So we can categorize sectors of the economy for coronavirus fighting policy into four groups. There are sectors of the economy that are safe, maybe because they're done online or otherwise they have people at a substantial distance. And whether they're essential or non-essential, we want to keep those going. We want to keep as much of the economy as isn't putting us in danger going, and so it done in an online way. Education is a safe sector of the economy, and so we're keeping it going. And like all other safe sectors of the economy, it's a good thing to keep that going. We don't want to have less of things that are safe. There's also some sectors that are unsafe and essential, and I think grocery stores are a good example. It's very tough to go to a grocery store without facing some risk of transmission of the coronavirus. But if people need food, and I think there'd be a lot of panic if grocery stores were shut down, quite understandably. So we need to keep grocery stores going, and other essential services. One quite unsafe but very essential service is healthcare. And so there might be some aspects of healthcare that are non-essential because they can be delayed. A simple example is plastic surgery that can be delayed. But there are a lot of other aspects of medical services that not only need to keep going, but need to expand. You have to have the unsafe essential service of treating people with the coronavirus. Finally, we come to unsafe, non-essential parts of the economy. And here, there's the obvious examples are things like restaurants and in-person entertainment, and that there are a variety of other things. A lot of kind of shopping for shopping in the mall. A lot of that is non-essential, and so we actually want to just shut those down because they all create a risk of transmission of the coronavirus. So going back to here, that's why this decline in GDP is happening. We're intentionally shutting down big chunks of the economy, like entertainment and non-essential retail and restaurants, that we think are, we can survive without, we won't suffer too much without, and we can really reduce the risk of transmission of the virus through social distancing. Now we don't know how long we're going to have to do that. One of the things it depends on is whether we get better at detecting who has the virus or who might well have the virus. If we can get good at detection like that, then we still have to have pretty severe social distancing for a while to get the total number of cases down to where we have enough resources to test all the people who need to be tested. But if we can't get a good testing regime, then we probably need to have social distancing for much longer. At any rate, however long our intentional shutting down of big chunks of the economy for social distancing lasts, we face some problems after it's over. Here, Donald Marone talks about protect productive capacity to avoid this loss. And I really like how he's laying things out. Here, the way I think of that is think of all those restaurants that are shut down intentionally over here. A typical restaurant has to keep paying rent, even though it's not earning any revenue in the current situation. Or for a while maybe they earn a little bit of revenue from takeout, but it's after probably it's tough to pay all the salaries with takeout, so they're likely to shut down, and then they're just out the rent. And so after everything's over, these restaurants have suffered a big financial hit, and many of them will go bankrupt. And that's really too bad. You have restaurants that were otherwise healthy, and you want them to come back. That's going to be true with a lot of this other retail that we're shutting down, and entertainment. I just read that, for example, Cirque du Soleil is hurting quite a bit. Cirque du Soleil shows are really wonderful, and it would be a real pity if we come out of this crisis and Cirque du Soleil is gone from the earth. Now the concern here is actually not literally bankruptcy, but companies going out of operation. And I think most small businesses, if they go bankrupt, also will go out of operation. Big businesses, it's a different story. With big businesses, going bankrupt simply means that the bondholders end up owning the company instead of the stockholders. And many large businesses that have issued lots of bonds are able to keep in operation even if they go bankrupt. So we don't necessarily have to rescue all the big businesses that have a lot of bonds. But typically, I think when small businesses go bankrupt, they won't come back. And so we do need to rescue them. And there might be some big businesses that would be in danger of going out of operation if they went bankrupt, and we might want to rescue them. So that's a big deal. But there's this third part of the economic strategy. If you rescue these firms, and if you have the social safety net, which of somehow transferring resources either by loans or outright transfers to people who are hurting financially, who are many of them struggling financially to begin with, that they don't have much savings, and then they're losing their job because we've shut down some sectors of the economy. then could be very hard on them. I still think it's the right thing to shut down those sectors of the economy, but we should uh, transfer money to these folks, or at least loan them money, or some combination and of loaning and transferring. So if you rescue some of these small businesses, if you rescue some of the people at the bottom who are financially hurting, that will help aggregate demand, because those small businesses and the people who are really hurting financially will probably spend most of the money that you transfer to them. But it's possible that still isn't enough to have aggregate demand at the level that you need to, and that's where negative interest rate policy would come in. And I'll mostly talk about negative interest rate policy later, but it is very powerful in adding to aggregate demand. So now I want to look at it's going to be sort of saying going through these ideas again, but I very much like the way Donald Barone says it, his exact words. So let's go through those. So he says, first, some immediate decline in economic activity is necessary to combat the virus. We want risky activities to stop. We know GDP is not a measure of social well-being. That's especially true today. Policy should not try to fill that hole. Second, we want our productive capacity to rebound once the virus risk recedes. COVID-19 shouldn't destroy otherwise healthy businesses, nonprofits, etc. As just one example, that's why the UK is now offering business interruption loans. So here in this tweet, this phrase, otherwise healthy businesses, is really crucial, is really important. This idea of businesses that would have done fine if it weren't for the coronavirus shock, we don't want them to go out of business. We want them to resume operations after the coronavirus is under control, however long that helps. So we need to rescue them. One thing I didn't mention before is that's an issue with nonprofits as well. So one of the friends, one of our family friends, is the head of a small nonprofit that gives counseling to women who are in trouble. Maybe many of them have been beaten, or they're very poor, or they have other troubles, and they're because they're trying to transition to counseling online, but some of these folks who need counseling are a little less comfortable doing counseling online, so they have fewer people showing up, and the way that the insurance reimbursements and some of the government payments for this counseling are then less, and they still have to pay the rent. So this coronavirus shock is a strain on small nonprofits as well, and possibly some large nonprofits. So you want to have some way of rescuing them too. Okay, so then third, he says we want to make full use of our productive capacity once the virus risk recedes. Fear, uncertainty, and job loss could stifle demand. That's why we see proposals to distribute cash, cut payroll taxes, etc. Now, if it were really just aggregate demand that was the issue, I would think negative interest rates could do the trick. But he says something important here. Expanding safety net programs like unemployment insurance, paid sick leave, and Medicaid would also support demand. But those policies can often be justified on health and social insurance grounds before even considering their macroeconomic effects. So what does he mean by social insurance? He means the same thing I've been talking about people who are really financially suffering as a result of the coronavirus shock. Often people who are financially on the very edge before this shock, and this, if it causes them to lose their job, and which is happening to many people, at least while the intentional shutdowns are happening, now they have very little savings and they're in big trouble. So we do want to help out people who are in big trouble, and that, along with rescuing the small businesses and small nonprofits and possibly some big businesses, is indeed going to support aggregate demand. And the small businesses and the people in financial trouble that you've rescued probably will spend most of the money that you transfer to them or loan to them from the government. And so that will support aggregate demand, but it's possible that that's not enough, and you might have to lower interest rates, which again we'll talk about later. So thanks very much for listening. This is the first one of many. There'll be many more online lectures to come.